evening and welcome to another edition of the Women's Magazine, a program that looks at issues affecting women and how to tackle those issues to develop our beloved nation. In our tonight's program, a recap of our 2013 programs, whereas Women's Magazine have faced numerous challenges in the production of the program, and also Women's Magazine have made tremendous support in achieving development issues of women. I am Fatoumata Simaha. Thank you for joining us. During pregnancy, a woman's body goes through many changes. These changes are entirely normal, but may become very important in case there are complications or problems. A pregnancy-related death is defined as the death of a woman during pregnancy. What can women do to prevent pregnancy-related death?
We run antenatal care services here every day except Sundays. Saturdays are also for working mothers, as said before, and it's still on. So when antenatal, we see different areas come to the health centers but Serakunda is purposely Thursdays, but the other areas like London Corner, Latrikunda, German, Talinding, Churchestown, they all come here. And the services available here, we do health talk before we start our clinics. There is a trained nurse, a community health nurse who does mostly the health talks, and then we take their blood pressures, we weigh them, we tell them why we do that before we start anything. Anything we do for them, we explain it to them. We take their blood pressures, we weigh them, and they come. This table is where we do the bookings. The booking is done by very senior skilled people because booking is very important. That's where it starts. If you take patients, if you book patients wrongly, you will get a wrong diagnosis of the patient. You will not know whether this is very high a risk. Though nowadays we see every pregnant woman as a risk until they deliver normally. So when they are booked, we know their risk score, at least where to. We would then start advising them on where to deliver, either in the health center or in a hospital.
Many factors influence pregnancy-related health outcomes. It is important for all women of reproductive age to adopt healthy lifestyles. Health talks are available to ensure that pregnant women receive appropriate medical advice and care. I was aware that GAMCO will stage a mega event, which is the International Day of Zero Tolerance to FGM. How long have you been fighting FGM?
GAMCO was engaged in the fight against FGM since 1984 as a specialized committee under the Women's Bureau to raise awareness on issues that are surrounding the practice of female genital mutilation.
Mm-hmm. How will you rate the successes achieved in the campaign against FGM?
I think there has been a lot of successes. For instance, if you look at it, without counting or recording specifically the number of people who have been directly reached. When we say directly reached, we mean who we have come face-to-face contact with through training programs, through sensitization programs, through awareness programs, has gone from between 2004 to 2011, have gone up to 12,956 people in the Gambia who are Gambians who have benefited from the training we have been doing during this period. And if you multiply that by 5 people per household, you're talking about over 64,780 people who have gotten the information through the issues affecting women, such as female genital mutilation.
Hundreds of influential women leaders, among them the Vice President and Minister of Women Affairs, Aja Dr. Aisatunjai Seidi, several First Ladies and parliamentarians, earlier in June descended on the Nigerian capital Abuja for the second high-level meeting of the Global Power Women Network Africa. The convergence, which was first held in Harare, Zimbabwe, was officially opened by President Goodluck Jonathan of Nigeria. The meeting afforded the delegates a platform to review and adopt the outcomes of the previous meeting, as well devise strategies critical to the post-2015 development issues. We now bring you excerpts of the meeting.
June 27 to 28, 2013 was a very eventful year for players in the domain of women's empowerment as they gather in the Nigerian capital Abuja under the aegis of the Global Power Women's Network Africa. The network of influential African women met to review and identify struggles to accelerate and consider key post-2015 issues. Ellen Johnson Sirleaf was among those at the fore of those efforts.
590 million children in developing countries attended primary schools. Yet, there is much unfinished business from the MDGs. Women and girls in particular need protection of their property rights, their access to land, and to have a voice to participate in economic and political life. They want a global focus on ending violence against women and discrimination at work, at school, and in the law.
Equality, equity, and the empowerment of women cannot be addressed without addressing where the root causes are. First of all, if it comes to programs, we have to start at the policy level. We have to convince the policymakers first and foremost to be convinced that gender is critical, it's important. The rest of society, starting from the household level, you also have to convince them that indeed gender is critical, women are important, and they can make a difference. At the national level, you have to convince everybody else, especially our people involved in development, our economists, our policymakers, and so on. Tell them that they stand to benefit to involve women in the development process. Convince them and show examples how development through women can result in development for all. That development through women can also be efficient and effective for any development program. So that's the starting point. Once you do that, now you can look at also the legislative environment, because some of the things require legislation as well. But not just legislation like signing protocols, conventions, agreements, and so on at the global level. But you have to translate those at the national level as well. In other words, we have to domesticate some of those protocols and agreements into our own laws, national laws, which means there must be law reform, law review, because that is critical as well, so that it's relevant to your country's needs. And that is what we have done in the Gambia.
The Gambia Women Finance Association GAWFA's mission as a non-governmental, non-profit making organization is to build a sustainable women's development that will serve as a financial intermediary to enhance the entrepreneurship development of women. This is also serve as a means of eradicating their poverty and increase their participation in the socio-economic development of the Gambia. The association recently benefited from the financial support from the Spanish Agency for International Development Cooperation. The support is to help especially rural women to fight hunger and underdevelopment. The package also includes software installation to allow users exchange data and receive and inquire about their